Hello, Assalamualaikum. My name is Mohammed Ghazali and I'm your OET trader in this M&M Institute. This is our third class that we will be discussing about the writing subject. In the previous classes, we have discussed about the purpose of writing and the selection of the case notes. In today's class, we will be discussing majorly about the organization and layout. As we are discussing about the organization layout, and I have selected a letter that would be a little bit difficult and different from our day-to-day task. So now you can see, even if you are a doctor or a nurse, you might be writing to your the letter to your same like professional person. Like being a doctor, you will be writing to a doctor most of the time. Being a nurse, you will be writing this letter to a nurse most of the time. However, here we are writing this letter to a different professional person. So this might be challenging, first of all, in order to understand like the purpose. Sorry. So over here, while understanding the purpose of writing, we can see that we are writing this letter to a school psychologist. So before we can move on, you have to be in the shoes of school psychologist, right? And what is the reason of writing? I have extracted this thing for you after reading the case notes. We should request this school psychologist to identify the significant factor for the assessment, as we believe that either she is having some underlying grief or maybe some other problem. So this is the main concern. This is the main reason of writing. With reference to that, from this information, we have to select the relevant case note first. Let's say, as this class focus is the organization, so I will not be spending much time on the we can say selection of the case notes, but in the organization. So we will be quick in the selection. If you can see this particular history over here, like this one, from 2010 to 2009, you can see time and again the patient was coming to you for different complaints such as headache, maybe eczema, stomach ache, aching legs, for example, and so on. Now you can see these things might not be relevant for the school psychologist. So we might not be writing all this information, or if you will be writing, just give an overview in 1 or 2 lines. So you can see first in selection, we have omitted this information. Apart from the eczema that we'll be writing over here, but like the headache, for example, but you can see there is a repetition of headache. That might be a point that might like catch the interest of the school psychologist. Yes. Right? Because there's a repetition. Initially, when I have seen this information, so I just cut it down because it has no relationship with the case according to the situation. But when I see the game, I can see that it's a repetition of the same things. So I don't know, like possibly we have to identify the triggering factor behind the psychological problems. For that reason, we should write it down in a summary form. That's why we just have labeled this thing as a semi-relevant information at the moment. We should not be judicious at the moment that whether we have to omit or we should consider this thing as a semi-relevant information. Why is that? Because for example, what I believe, there is a repetition of the complaints. That's why I have to give this thing gravity. Fine? Okay. Now we can see for a psychologist, there are some factors that are quite important. Let's say she is studying in grade 5. It's quite important. It's very important. Youngest in her class, again, it's very important information. Yes. We might miss this thing. Let's say she's youngest. Why? No, it's very important because she might be subject of bullying in school. So we have, I will not write down at the moment that people are, like she's being subject of bullying in school, because we cannot infer. But I'm just telling you that we have to write down something so that psychologists might have an idea. Okay, this could be a possible triggering factor in her this psychological problem that she's facing at the moment. Anyhow, her father died of car accident. It's also an important factor, and you can see she was very close to her father. It's very, very important information, right? Yes. So, living status, again, very important. Siblings, very important. And paternal grandmother is important. And school record history. Now, it could be also important because, like In the first year, she only had the absence of 2 days. In the third year, we have absence of 4 days. In the fourth year, we have absence of 10 days. Still it's fine, right? But in the fifth year, only in first term, she had absence of 8 days. So it's a quite important thing. We can write it down in a summary form. Now you can see if we write down the sequence, we have this information that has been mentioned over here. So we should not be writing in the sequence, rather we have to organize. As you can see over here, this is the class of organization, so we like to write down certain things together.
But this is the irrelevant things.
It could be semi-relevant, not relevant even. But we write down in 1 or 2 lines. Why? Because there is a repetition of the complaint. Headache is, she's having headache time and again. She's having this again. We don't know for sure, but we can write down somewhere below. And even we can.
Sometimes psychological problem is related to that stomach problem, headache.
Yes, that's why.
Nausea.
That's why I'm telling you that, as you mentioned, that sometimes these nausea and headache could be related to the psychological problem.
But if we will think about deeply, not it's relevant to the mental health issues. But if we think deeply that maybe the other, like if the nausea, if we will think deeply that maybe it's cause of the psychological issues.
Yes, that's why as we are discussing today's class regarding the organization of the case notes. In organization, sometimes you have to summarize certain information, and depending upon the gravity of the information, we have to expand the information. So as you can see that we are not sure that why she is having this headache or nausea. For that reason, what we are doing is, first of all, we will not be writing this thing in priority. Number 1. Second thing, we will not be writing in the sequence of the case notes. Now this is the sequence of the case notes. We have to sequence as per importance. So how about we sequence? Because the social history is quite important. Over here. This personal history is also important. So writing after the introduction, we write it down the personal history along with the social history, step by step. We can combine them together. Now you can see the social history, all things are quite important. She has concentration problem since grade 3, and you can see that can be related. Number of absence has been increasing in the school. So this is the integration. If she has absence problem, it can be integrated with this one. Like you can write down this thing together. Now this is the time when you have to bring clarity in your writing, right? Because you have to organize the same group of information together. So double concentration, really participate in classroom activities. Like she is not interested in class. Again, you can see that can be confirmed from the school record. So we can write down this together. Then similarly, they have added sports activities. So it's breaking the coherence. For example, we write down school standard is declining. Why? Because she is not interested in class activities, like class participation is quite low, and that can be seen in the home task as well. So all these points can be written together, followed by your sports activities. So we can just flip this point over here and this one up above. So this is called the organization. You can see the sequence of the case notes might not be the appropriate sequence, right? The given sequence that has been given to you in the case notes might not be the appropriate sequence, but you have to organize, you have to shuffle, you have to group, you have to combine the history as per the importance. Why? So that it will bring symmetry, number 1. Number 2, it will bring clarity and coherence, right? That is the next criteria anyhow. So basically you can see trouble concentration, participation, class, school absence record, and you can see school standard of work is declining. Write all these things together, right? But in a form that can be coherent to understand. Followed by the sports activities. You can write it down together. And then you can see another. We can see that
Few friends are confused.
we can see even trouble concentration, school behavior that was confirmed with the home. My mother reported that she'll also withdraw. So now it's up to you. You can write down these things together. Like father died 18 years back. She was very youngest child, and her mother reported after the school contacted her that she is also isolated and withdrawn at home, often cries and remember her father. So now we can group them together.
Because she
Right?
was very
So
close to
now
her.
you can ask, I can ask you, he is a school psychologist and he has to identify the major problem for her grief or if there is a psychological problem. So should you write down the trouble concentration of school activities first or her father related history first? Like she was quite attached to her father. So which one is more important?
Problem is more important and then explanation is important.
For problem of what?
Initially,
Initially, while
focus
we
on
are
that
concerning school psychology.
Okay, you're saying that you believe it should be written first.
Yes,
Okay, and father history should be written below.
yes.
But as you can see, the child, father died and she was quite close. Since then, she is not interested in life. We are not going to make an inclination of the psychologist toward anything. We just have to write it down. So now you have to prioritize as per your knowledge that which information need to be written first. We can just write it down as per you are saying that we can start with trouble concentration in the school, then school attendance record, and then we can write it down that she is often, we can say isolated, withdrawn at home because of father. Yes.
And the second factor is that she was the youngest in her class, and the few friends often teased by the classmates.
Yes.
It is maybe a cause of the
Yes. So we can see we have two causes that we have identified. We will not show the inclination. We just write them neutrally. Now this is the job of the psychologist to understand. We have to provide the case.
Yes, sir, but we sharing the first problem of child.
Yeah, both are the problem of the child. Now this is the time to organize.
But we will
That
follow
one is
the,
the cause of
we will follow
cause
the
of problem.
We don't know.
sir, we will follow the sequence and the organization. Sequence means from the initial that the patient child withdrawal behavior and she was youngest, she was absent from the school. After that, the death might be occur after in
Sir,
You can
the
see-
first one is the concerning point that's why we contact with the school psychologist.
Okay. So first of all, now this is the time for the integration. She is right now year 5 student.
Yes, sir.
12 months back, she was year 4 student.
Yes.
Further 6 months back, maybe she was in grade 3.
Yes.
Right?
Yes.
And now they can see that she is having trouble concentration since grade 3. So we don't know, for example, her father died 18 months back. So right now she is year 5 student. So 12 months back she was year 4 student. Further 6 months back she was year 3rd student. That was the time when the problem was started.
Yes.
So now this is integration.
integration.
You got my point? So the major thing, but I don't know, but I'm just trying to give my point of view. I could be wrong for the sake of discussion. I'm just having an argumentative debate with you so that you can ask the question. I could be wrong at this point, but I want you to learn the organization because this is one of the most important criteria. And passing and failing can be sometimes dependent on this criteria, even solely. If your purpose, like what is the purpose of writing? We know what is relevant. Now we are having a debate. And sometimes, honestly speaking, yourself, while writing a letter, you can be having a debate inside yourself.
Yes, sir.
Yeah.
So that's why we are having a debate.
Yes, sir.
We are having argumentative debate over here that I'm trying to make my point of view.
Yes, sir.
I'm trying to have an argument session with you so that we can decide which thing is relevant. What I am trying to present is, for example, this is year 5, she's year 5 student at the moment. Her father died 18 months ago. So, right, if we can move back, she might be at the end of 3rd year. So, it's written that since grade 3, this problem was encountered.
Yes, sir.
So, we have an edge, whether it started right after the death of her father or started before. We don't know. But it's very close call.
Yes.
Because the time, if you can see the timeline of both events they are in the close call.
Yes, sir.
Like her father death and grade 3 is almost on the same call, right? Anyhow,
But we convey the information, both information to the
we will convey.
psychologist.
We will convey. I'm not having an argument on the selection of the case notes.
Okay.
That was the argument. If you can see the selection, should we write down the same? There is no argument. It's very important to write down all this information and the social history. We had an argument on the medical record. We had discussed that we write down somewhere below in 1 or 2 lines, like over the period of 2 years, she presented multiple times in, let's say, whatever,
Yes.
like that. Yeah, she has had visited us. Yeah, she had visited us thrice, right? Yeah, she had her medical record showed that she had, let's say, multiple medical visits for multiple problems, which includes. We can just write in a brief overview form at the end of the letter, but not in priority. Why? Because we are confused. She might have this problem just because of some underlying psychological issue, but we don't know for sure, right? So this is something that you must understand. Now we are having an argumentative speech on a point of fact that should we write down her father death problem first, or should we write down her school concentration problem first? So you were having a point of view that we should write down the problem she is having difficulty concentration, and I was having an argument that I should write down the father problem first. So I had given my stance because if you can integrate the things together, because sometimes in the writing you have to be open in your mind and you need to integrate things together. So while integrating, I came to know that her father death event and the problem concentration may coincide with each other, like it's very close to each other.
Yes, sir.
Maybe a difference of 1 or 2 months or 3 months or 4 months, like we don't know for sure. And secondly, her mother reported that she oftenly remembered or recalled her father, cries for her, right? So that's why it could be like the most important detail should be written in focus.
Yes.
So, you know, like while organizing the case note, it will decide your focus of writing. First of all, you must have very clear focus as per the purpose of writing.
Yes, sir.
So now you can see how organization has a direct relationship with your purpose of writing. So people, I would like to give this message to the audience who will be listening online and to the people who are sitting over here. Remember, like this is a common term. I listen from my student that, okay, my purpose is clear. Would they label purpose as just a merely introduction? Yes, your purpose of writing has to be clear in the introduction, but your purpose is not only the introduction. Your whole letter can be considered as a purpose. As you can see over here, in this particular letter, if I would not put something right after the introduction, my focus will be shifted, I will be deviated from the track, and my purpose will be affected. So, just because of the fact I have not organized the information as per the requirement of the task,
Yes, sir.
my organization will be compromised. I could have penalty for that. And my, for example, purpose will also be compromised, number one. Number second thing is, for the sake of example, if somehow, I'm not going to do this thing, but if somehow I'm going to make this mistake that I will write down this thing right after the introduction. This is also a major mistake in organization and it's a blunder.
Yes, sir.
Now this is blunder. So yes, you can remember, recall, on the first class, we have discussed a pro tip for you. And what was the pro tip? Never write down semi-relevant information for relevant.
For relevant.
That was a pro tip for you. Because if you have written semi-relevant information, as you can see, this is an example in front of you.
Yes, sir.
In front of you this example, if we have written first of all this information up above, right after the introduction, so first it will affect your purpose drastically. It will shift the focus of writing. Second thing, it will also affect the organization. Why? Because when you will be writing this thing right after the introduction, you can see that you will be writing in, like you can be expanding the case notes.
Yes, sir.
And while you are expanding, again, you are writing those things that might not be relevant for the psychiatrist, psychologist. So a major mistake. Then you can write down in this thing, again, blunder. Secondly, if I can follow the sequence, you can see this is a trick. They can write down the personal history and social history together, but they have done other way around, so that they can test you. So this is a trick for you that first of all, the social history, that was almost everything was relevant. We cannot say that anything is irrelevant over here. Followed by the treatment record, that is irrelevant. So you can see, this is a common mistake candidates do under pressure, that they write down the sequence. So it will break the clarity, coherence, and ultimately affect your organization. Yes, sir.
Sir, is this possible? First we have to write the relevant information, because when the psychiatrist, any doctor going to take the assessment of the patient and take the history of the patient, they also ask about the history, past medical history, and social, each and everything. So first we have to mention the relevant things, because to focus to the purpose, we have to follow the track, and we mention the relevant things like her father died and the school behavior, each and everything. After that, we can able to mention these school health, eczema and other
Okay.
things.
So you have asked a question like, first of all, in any letter, first we should write down the relevant information, right?
Yeah.
And then should we write down the irrelevant or not? That is the question, right? Okay. As per the legislation set out in the OET handbook for your writing case notes, they won't prefer you to do this thing. If something that is totally irrelevant, there is no point of writing this thing. Why? Because if you recall the second criteria, you can find this thing on our YouTube channel as well. We had a class yesterday that is on the content of selection.
Okay.
Right. But if you have written irrelevant information, let's say by mistake, obviously you are not going to write this thing intentionally. By mistake, if you have written the irrelevant information, now depending upon where you have written, if you have written either irrelevant or semi-relevant information in priority, that is a blunder.
Exactly.
Maybe it might not be set out in any rules, regulation, or any written form you can find in the OET booklet. Although there is, but I'm just telling you, I have seen for this thing for sure from the student feedback in the real exam, when they have done this type of blunder, before the exam, we would have an idea, and we had seen it has been a proven track record, they were not able to qualify the exam. With this mistake, even writing a single word, for example, if I can just write down a single word, she has been treated for headache, right after introduction, it's a blunder. In this particular case, because we are suspecting, like maybe in third or fourth layer, this could be related to some psychological problem, because it has nothing to do directly. As compared to father death, as compared to problem concentration, the headache is not significant and relevant. We don't want to miss them, because we said, okay, fine, we can have, because there is a repetition of complaint. If there was no repetition of complaint, then in that case, we would not have written this complaints of headache. So now the debate again was whether to write it down this detail first, along with the father history, or the school concentration. So what I believe that in this regard, we should let it open. I will discuss after this video with you people. But in this video, it's your option. You have to comment in the comment section that should we write down her father history, like she was quite close to her father, and her mother reported that she is having some strange behavior, like she is withdrawn, and secondly, she cries oftenly, and remember her. So this is a question for the online audience, that you have to tell us, like right after the introduction, should we write down her father death related history first, or should we write down her problem with the school activities? And you can comment us, we will give you the feedback on here. So right now, we like to ask you, and comment if you have any question. You can feel free to ask me, because today we are going to end our lecture for today's class for the organization. Now in the class we will be practicing this letter. I will be sending you the case notes, and tomorrow inshallah in our online class as well, we will be having a lecture on the conciseness and clarity, genre and style, and the language component. As we discussed, you remember that first 3 days we will discuss separately purpose, selection, organization, as these 3 criteria are the major criteria. For that reason, we had given one single day to each criteria. Now, the next 2 criteria are not important. I'd say it's important, but not that much important comparative to these first 3 criteria. So we'll be discussing in detail about the conciseness and clarity tomorrow, followed by genre and style, and the language. And yes, for the language component, we will have a class, like maybe on this coming Monday. On Friday, we will be having a mock exam, complete for all of you people. Despite the fact you may have not have any idea about reading and listening, but still, I would encourage you to take for the full year purpose the mock exam at 10 o'clock or 10:15. You can take the speaking. Speaking you should miss it, like because you have no idea even. But just take the listening, reading, and writing mock on Friday, and for the honor journalism. Anyhow, then we have a writing class on Monday. So tomorrow, inshallah, we will be discussing in detail about the conciseness and clarity. On Friday, you will be having mock exam, and then on Monday, we will be having a dense class on the grammar, and on Tuesday, we will be starting our component of speaking, right? So I hope you would have, if you would have any question, please feel free to ask me first. And on the people who will be watching us online or after when we post this video, so you can ask any question in the comment section. We will try to respond to you as soon as we can. And we will be having next video on the conciseness and clarity. So stay tuned with M&M and have this pro tip regarding the writing. Thank you very much.